If you're over 60 and waking up feeling exhausted despite a full night's sleep, or noticing that your muscles ache more than they used to, what I'm about to share could change everything. There are two specific vitamins that, when taken before bed, work while you sleep to restore your energy and help your muscles repair themselves overnight. But here's what concerns me as a physician. Most people over 60 are deficient in at least one of these, and many don't even know it. The consequences? Chronic fatigue, muscle weakness, poor sleep quality, and a cycle that gets worse with each passing year. My name is Dr. Emily Hartman, and I'm a geriatric medicine specialist with over 15 years of experience working specifically with older adults. Throughout my career, I've seen thousands of patients struggling with low energy and muscle issues, and I've watched how the right nutritional approach can transform their quality of life in ways that seem almost miraculous. What I'm sharing today isn't about expensive supplements or complicated routines. It's about understanding how your body changes after 60 and giving it exactly what it needs during those crucial overnight hours when healing happens. Before we dive in, if you haven't subscribed yet, I strongly recommend hitting that subscribe button and turning on notifications so you never miss another health tip designed specifically for you. If you find this video helpful, please leave your questions and video suggestions in the comments below. I read every single one, and it helps me create more content to help people just like you. Let me tell you about someone I'll never forget. Mr. Carlos Mendez, a 72-year-old retired teacher from São Paulo, came to my office about 3 years ago completely defeated. He told me that he used to wake up ready to play with his grandchildren, tend his garden, and enjoy his retirement. But over the past 2 years, everything had changed. He'd wake up feeling like he hadn't slept at all. His legs felt heavy, and simple tasks like climbing stairs left him breathless and sore for days. His wife noticed he was becoming withdrawn, declining invitations to family gatherings, and spending more time sitting in front of the television. When I ran his blood work, I found something that didn't surprise me at all given his symptoms. His vitamin D levels were critically low, sitting at just 14 nanograms per milliliter, when optimal levels should be between 40 and 60. His magnesium was also on the lower end of normal. Carlos looked at me confused and said, "But doctor, I'm outside in my garden all the time. How can I be low in vitamin D?" This is exactly the misconception I want to address today, because Carlos's situation is far from unique. Here's what most people don't understand about vitamin D after 60. Yes, sunlight helps your body produce vitamin D, but here's the catch. As we age, our skin becomes significantly less efficient at synthesizing vitamin D from sun exposure. Studies show that a 70-year-old produces about 75% less vitamin D from the same amount of sun exposure compared to a 20-year-old. Add to this that many older adults, wisely avoiding skin cancer risks, use sunscreen or cover-up when outside. The result? A silent epidemic of vitamin D deficiency among seniors that's contributing to fatigue, muscle weakness, bone problems, and even mood issues. But vitamin D does so much more than just support bone health, which is what most people know it for. During sleep, vitamin D plays a crucial role in muscle protein synthesis, which is the process your body uses to repair and build muscle tissue. When you're deficient, this overnight repair process becomes sluggish and inefficient. Your muscles don't recover properly from the day's activities, leading to that persistent soreness and weakness that so many seniors accept as normal aging. But it's not normal, and it doesn't have to be your reality. Now, here's where the timing becomes critical, and this is something I emphasize strongly with my patients. Taking vitamin D before bed aligns with your body's natural repair cycles. During deep sleep, your body releases growth hormone, which works synergistically with vitamin D to repair muscle tissue and restore energy stores. When you take vitamin D in the evening, you're ensuring optimal levels are present exactly when your body needs them most for these overnight repair processes. Let me share another case that illustrates this perfectly. Mrs. Ana Paula Silva, a 68-year-old former nurse from Belo Horizonte, came to see me complaining of terrible leg cramps that would wake her up in the middle of the night. She'd be sleeping peacefully, and suddenly her calf would seize up in an excruciating spasm that would leave her limping the next day. She tried everything: drinking more water, stretching before bed, eating bananas for potassium. Nothing worked. Her sleep quality was suffering terribly, and the fear of the next cramp kept her anxious at bedtime. When I reviewed her medications and supplements, I noticed she was taking a calcium supplement her previous doctor had recommended for bone health, but nobody had ever mentioned magnesium to her. Here's what was happening. Calcium causes muscles to contract, while magnesium allows them to relax. Ana Paula was getting plenty of calcium, but not enough magnesium to balance it out. The result was an electrical imbalance in her muscle cells, leading to those painful nighttime cramps. Magnesium is the second vitamin, or more accurately, mineral, that I want you to understand today. After 60, magnesium deficiency becomes incredibly common for several reasons. First, many medications that seniors take, including certain blood pressure medications and diuretics, can deplete magnesium levels. Second, our digestive system becomes less efficient at absorbing magnesium as we age. Third, chronic stress, which many seniors experience dealing with health concerns, loss of loved ones, or financial worries, depletes magnesium stores rapidly. But magnesium does so much more than just prevent muscle cramps. It's involved in over 300 biochemical reactions in your body. During sleep, magnesium helps regulate your nervous system, promoting deeper, more restorative sleep stages. It supports the production of melatonin, your body's natural sleep hormone. It helps convert the food you eat into energy at the cellular level. And critically for seniors, it works alongside vitamin D to support muscle function and bone health. If you're still with me and finding this information valuable, comment yes below to let me know you're following along. Your engagement helps me understand what content is most helpful so I can create more videos like this for you. Now, here's where this gets even more interesting. These two nutrients don't just work independently, they actually work together in ways that amplify each other's benefits. Vitamin D helps your intestines absorb calcium and magnesium more efficiently. Magnesium, in turn, is required to activate vitamin D in your body. Without adequate magnesium, the vitamin D you take remains in its inactive form and can't do its job. This is why taking them together before bed creates such a powerful synergistic effect. Let me tell you about Mr. Roberto Alves, a 65-year-old retired mechanic from Rio de Janeiro who perfectly illustrates this synergy. Roberto came to me exhausted, and I mean truly exhausted. He told me he could sleep 10 hours and still wake up feeling like he'd been hit by a truck. His muscles ached constantly, and he'd given up his weekend soccer games with his friends because he just didn't have the energy anymore. His wife was worried because Roberto, who had always been active and social, was becoming a different person. His initial blood work showed low vitamin D, so I started him on supplementation. After a month, he came back saying he felt slightly better but still not right. That's when I dug deeper and found his magnesium was low too. Once we added magnesium to his evening routine along with the vitamin D, everything changed. Within 3 weeks, Roberto reported that he was sleeping through the night, waking up refreshed, and most importantly, he felt like himself again. He'd rejoined his soccer group, and his wife said she had her husband back. But I need to be very clear about something important. Not all forms of these nutrients are created equal, and this matters tremendously for absorption and effectiveness. For vitamin D, you want vitamin D3, also called cholecalciferol, which is the form your body uses most efficiently. For magnesium, there are several forms, but for evening use and muscle support, magnesium glycinate is generally the best choice. It's highly absorbable and less likely to cause digestive upset compared to other forms like magnesium oxide. The typical dosage I discuss with my patients is around 1,000 to 2,000 international units of vitamin D, 300 to 400 milligrams of magnesium glycinate, taken about 30 to 60 minutes before bed. However, and this is crucial, you should absolutely have your levels checked and work with your personal physician to determine the right dose for your specific situation. Some people need more, some need less. and taking too much of either can cause problems. Let me share a case that demonstrates why personalization matters. Mrs. Beatriz Santos, a 74-year-old retired seamstress from Curitiba, heard about vitamin D from a friend and started taking 5,000 international units daily on her own. After a few months, she developed nausea, increased thirst, and confusion. When she came to see me and we checked her levels, her vitamin D was dangerously high, causing calcium to build up in her blood. This is rare, but it happens when people take very high doses without monitoring. Once we stopped the supplement and her levels normalized, she felt much better, and we restarted her on an appropriate, monitored dose. Now, you might be wondering how long it takes to feel a difference. This is one of the most common questions I get. Based on my clinical experience with hundreds of patients, most people start noticing subtle improvements in their sleep quality within the first week. The muscle aches and morning stiffness usually begin to ease around the 2 to 3 week mark. By week 4 to 6, most patients report significant improvements in their overall energy levels and sense of well-being. But if you think that's impressive, wait until you hear about the additional benefits that often surprise my patients. Mrs. Lucia Ferreira, a 69-year-old retired librarian from Porto Alegre, came to see me primarily for fatigue and muscle weakness. We started her on evening vitamin D and magnesium, and yes, her energy improved dramatically. But what she didn't expect was how much her mood improved. She told me at her follow-up visit that she felt like a fog had lifted. She was laughing more, enjoying activities again, and her family noticed she seemed more like her old self. This connection between these nutrients and mood is something I wish more people understood. Depression and anxiety are incredibly common in older adults, and while there are many contributing factors, nutritional deficiencies play a much larger role than most people realize. I can't tell you how many times I've seen patients who were about to start antidepressant medications experience significant mood improvements simply by correcting their vitamin D and magnesium levels. I'm not saying these nutrients replace proper mental health treatment when it's needed, but they're an essential foundation that shouldn't be overlooked. Let me tell you about Mr. João Silva, a 66-year-old retired bus driver from Manaus, who came to my office at his wife's insistence. He was irritable, withdrawn, and had lost interest in fishing, which had been his lifelong passion. His wife said he'd snap at her over small things, and he'd stopped going to their Sunday family gatherings. João himself admitted he just felt off, but couldn't explain why. He wasn't sleeping well, felt tired all the time, and his muscles ached constantly. He thought maybe he was just getting old and grumpy. When we checked his levels, both his vitamin D and magnesium were significantly low. I explained to João that what he was experiencing wasn't just aging or a character flaw. His body was literally lacking the nutrients it needed for proper nerve and brain function. We started him on both supplements before bed, and I'll never forget his follow-up appointment 8 weeks later. His wife came with him, and she couldn't stop smiling. She said, "Dr. Emily, I have my husband back." João himself said he felt like someone had turned the lights back on in his brain. He was sleeping better, had more patience, and had already been fishing twice that month. This isn't surprising when you understand the science. Vitamin D receptors are found throughout your brain, and adequate vitamin D levels are crucial for mood regulation and cognitive function. Magnesium supports the production of serotonin, your body's natural mood stabilizer. When you're deficient in either one, it doesn't just affect your physical health, it impacts your mental and emotional well-being too. Many seniors who think they're just dealing with age-related blues or early dementia are actually experiencing the effects of nutritional deficiencies that are completely correctable. Another aspect I want you to understand is the relationship between these nutrients and sleep architecture. As we age, we naturally spend less time in deep sleep, which is when most physical restoration occurs. Vitamin D and magnesium both help promote deeper, more restorative sleep stages. Magnesium, in particular, helps activate your parasympathetic nervous system, which is responsible for the rest and digest mode that allows your body to truly relax and repair. Better sleep quality means better overnight muscle repair, better hormone balance, and better energy the next day. Understanding sleep stages is crucial here. Your sleep cycle consists of several stages, including light sleep, deep sleep, and REM sleep. Deep sleep, also called slow-wave sleep, is when your body does most of its physical repair work. This is when growth hormone is released, when your immune system strengthens, and when your muscles rebuild themselves from the day's wear and tear. As we age, we naturally spend less time in this crucial deep sleep stage. But here's the good news. Adequate magnesium levels help increase the duration and quality of deep sleep. Think of magnesium as the master relaxation mineral. It works by regulating neurotransmitters that send signals throughout your nervous system and brain. Specifically, it activates receptors for GABA, which is your body's main calming neurotransmitter. When your magnesium levels are low, your nervous system stays in a more activated, stressed state, making it harder to fall into those deep, restorative sleep stages. This is why so many people with magnesium deficiency describe feeling tired but wired, unable to fully relax even when exhausted. Mr. Fernando Costa, a 71-year-old retired engineer from Brasilia, experienced this firsthand. He complained that he would fall asleep fine but wake up multiple times throughout the night, often lying awake for an hour or more before falling back asleep. He'd tried sleeping pills, but they left him groggy the next day. When we optimized his vitamin D and magnesium levels, he started sleeping through the night naturally. He told me it was like turning back the clock 10 years on his sleep quality. He'd wake up naturally, feeling refreshed, without any grogginess or side effects. What fascinated Fernando most was when I showed him the data from a sleep tracker he'd been using. Before starting the supplements, he was spending only about 45 minutes per night in deep sleep. After 2 months of taking vitamin D and magnesium before bed, his deep sleep had increased to over 90 minutes per night. He could actually see the difference in his sleep architecture, which helped him understand why he was feeling so much more energized during the day. Now, let's talk about something that concerns many of my patients: interactions with medications. Both vitamin D and magnesium can interact with certain medications, which is another reason why working with your doctor is essential. For example, if you're taking blood thinners, certain heart medications, or thyroid medication, the timing and dosage of these supplements needs to be carefully coordinated. Magnesium can interfere with the absorption of some antibiotics and osteoporosis medications. This doesn't mean you can't take them. It just means you need professional guidance to do it safely and effectively. Let me break down some specific interactions you should be aware of. If you're taking bisphosphonates for osteoporosis, like alendronate or risdronate, you need to take these at least 2 hours away from magnesium supplements because magnesium can significantly reduce their absorption. Similarly, if you're on certain antibiotics, particularly fluoroquinolones or tetracyclines, magnesium can bind to these medications in your digestive tract, reducing their effectiveness. The solution is simple: timing. Take your antibiotics at a different time of day than your magnesium supplement. For those on blood pressure medications, particularly calcium channel blockers, magnesium can have an additive effect in lowering blood pressure. This isn't necessarily bad. In fact, it might allow your doctor to reduce your medication dose, but it needs to be monitored carefully to prevent your blood pressure from dropping too low. I've had several patients who were able to reduce their blood pressure medication after optimizing their magnesium levels, always under close medical supervision, of course. I had a patient, Mr. Osvaldo Pinto, a 73-year-old retired accountant from Salvador, who was on thyroid medication and started taking magnesium at the same time without mentioning it to his endocrinologist. His thyroid levels became unstable, and he felt terrible. Once we figured out what was happening and adjusted the timing so he took his thyroid medication in the morning on an empty stomach and his magnesium at night, everything stabilized beautifully. The lesson here is that communication with your healthcare team is absolutely essential. Another medication interaction worth mentioning involves diuretics, which many seniors take for blood pressure or heart conditions. These medications can actually deplete both magnesium and vitamin D from your body, creating a vicious cycle. You take the diuretic to help your heart or blood pressure, but it depletes the very nutrients your cardiovascular system needs to function optimally. This is why I always check magnesium and vitamin D levels in patients on long-term diuretic therapy. Many of them have been taking these medications for years without anyone ever checking their nutritional status. Mrs. Carmem Souza, a 75-year-old retired nurse from Goiânia, had been on a diuretic for her blood pressure for over a decade. She came to me complaining of severe fatigue, muscle cramps, and heart palpitations. Her previous doctors had run multiple heart tests, all of which came back normal, leaving everyone puzzled. When I checked her magnesium levels, they were critically low. The diuretic had been depleting her magnesium for years, and nobody had ever thought to check. Once we supplemented her magnesium appropriately, her symptoms resolved completely. She was amazed that such a simple solution had eluded diagnosis for so long. Let me address another common concern: dietary sources versus supplements. While it's true that you can get vitamin D from fatty fish, egg yolks, and fortified foods, and magnesium from leafy greens, nuts, and whole grains, most seniors simply don't consume enough of these foods consistently to meet their needs, especially given age-related absorption issues. Additionally, the amount of vitamin D you'd need to get from food alone to correct a deficiency would require eating salmon or sardines at quantities that most people find unrealistic. Supplementation, when done correctly, provides a reliable, consistent way to ensure you're meeting your needs. Let me paint a clearer picture of what this means practically. To get 2,000 international units of vitamin D from food alone, you'd need to eat about 7 ounces of salmon every single day. That's not just expensive. For most people, it's simply not sustainable long-term. Similarly, to get 400 milligrams of magnesium from food, you'd need to eat about 3 cups of cooked spinach, or 2 cups of almonds, or 6 cups of brown rice daily. While incorporating magnesium-rich foods into your diet is wonderful and beneficial, relying on diet alone to correct a deficiency is usually impractical, especially for seniors who may have reduced appetites or digestive issues. There's also the issue of nutrient density in our modern food supply. Studies have shown that the mineral content of fruits and vegetables has declined significantly over the past 50 years due to soil depletion and modern farming practices. The spinach your grandmother ate in the 1950s likely contained more magnesium per serving than the spinach available in supermarkets today. This means you'd need to eat even more of these foods to get the same nutritional benefit, which becomes increasingly unrealistic. Mrs. Helena Rodriguez, a 67-year-old former chef from Recife, was initially resistant to taking supplements. She prided herself on eating well and couldn't believe that diet alone wasn't enough. But after seeing her blood work and understanding the science behind age-related absorption issues, she agreed to try the supplements while continuing her healthy diet. 6 weeks later, she admitted she felt better than she had in years and wished she'd started sooner. She told me, "Dr. Emily, I thought eating well was enough, but I understand now that our bodies change, and sometimes we need extra support." What I appreciated about Helena's approach was that she didn't see supplementation as replacing good nutrition. She saw it as complementing her already healthy diet. She continued eating her magnesium-rich leafy greens and nuts, and she still enjoyed salmon regularly. But she acknowledged that at 67, with age-related changes in her digestive efficiency, she needed that extra insurance policy that supplementation provides. This is the mindset I encourage in all my patients: food first, supplements as support. I also want to talk about the financial aspect because I know many seniors are on fixed incomes and worry about the cost of supplements. The good news is that vitamin D3 and magnesium glycinate are relatively inexpensive nutrients. A month's supply of both typically costs less than what most people spend on coffee in a week. When you consider the potential costs of doctor visits, medications for sleep problems, pain relievers for muscle aches, and the impact of poor quality of life, Investing in these two nutrients is one of the most cost-effective health decisions you can make. One more important point I need to emphasize. While vitamin D and magnesium are incredibly important and can make a dramatic difference, they're not magic bullets. They work best as part of a comprehensive approach to healthy aging that includes staying physically active, eating a balanced diet, managing stress, getting regular checkups, and staying socially connected. Mr. Antonio Lima, a 76-year-old retired taxi driver from Fortaleza, learned this lesson well. The supplements helped tremendously with his energy and muscle function, but it was when he combined them with a regular walking routine and staying active in his community that he truly thrived. I've also noticed that many of my patients feel so much better once their levels are optimized that they become motivated to make other healthy changes. It's like a positive domino effect. When you have energy and your body feels good, you want to move more, eat better, and engage with life. When you're exhausted and achy, you tend to become sedentary and withdrawn, which creates a downward spiral. These two simple nutrients can be the catalyst that reverses that spiral and sets you on an upward trajectory. Let me share one final case that really captures why this matters so much to me personally. Mrs. Mariana Oliveira, an 80-year-old widow from Florianopolis, came to see me about 2 years ago. She told me, through tears, that she felt like she was becoming a burden to her daughter, who had to help her with basic activities because she was so weak and tired. She said she felt like she was just waiting to die. Her quality of life was so poor that she'd lost interest in everything she used to love: her garden, her church community, her book club. After optimizing her vitamin D and magnesium levels, along with addressing a few other nutritional gaps, Mariana had a complete transformation. When I saw her 6 months later, she walked into my office with energy in her step. She was back to tending her garden, she'd rejoined her book club, and she told me with a huge smile that she'd just signed up to volunteer at the local library. She said, "Dr. Emily, you gave me my life back. I thought my good years were over, but I feel like I'm living again, not just existing." That's why I'm so passionate about sharing this information. Too many seniors and their families accept fatigue, weakness, and poor quality of life as inevitable parts of aging. But so often, these symptoms are signs of correctable deficiencies, not irreversible decline. Yes, aging is real, and our bodies do change. But there's a huge difference between healthy aging and the decline that comes from unaddressed nutritional deficiencies. So here's what I want you to take away from our time together today. If you're over 60 and experiencing low energy, muscle aches, poor sleep quality, or just not feeling like yourself, talk to your doctor about checking your vitamin D and magnesium levels. These simple blood tests can provide crucial information about what your body needs. If you are deficient, working with your healthcare provider to supplement these nutrients, particularly before bed when your body is primed for repair and restoration, could be the key to feeling dramatically better. Before you go rushing to buy supplements, though, I want to give you some practical guidance on what to look for and what to avoid. When choosing a vitamin D supplement, look for vitamin D3, not vitamin D2. Check the label for cholecalciferol, which is the active form your body uses. Avoid products with unnecessary fillers, artificial colors, or excessive additives. A quality vitamin D3 supplement should have minimal ingredients. Just the vitamin D, a carrier oil like olive oil or coconut oil, and a gelatin or vegetarian capsule. For magnesium, as I mentioned earlier, magnesium glycinate is generally the best form for evening use and muscle support. Avoid magnesium oxide, which is poorly absorbed and more likely to cause digestive upset. Other good forms include magnesium citrate, which is well absorbed but may have a mild laxative effect in some people, and magnesium threonate, which is particularly good for brain health but tends to be more expensive. Read the label carefully to see how much elemental magnesium you're getting per serving, as different forms contain different percentages of actual magnesium. Timing matters tremendously. Take both supplements together about 30 to 60 minutes before bed with a small amount of food. The food helps with absorption and reduces any potential stomach upset. Some people like to take them with a small piece of cheese, a few nuts, or half an avocado. You don't need a full meal, just something with a bit of fat to help the fat-soluble vitamin D absorb properly. Give it time. I know we live in a world of instant gratification, but nutritional healing takes time. Don't expect to feel completely different after 3 days. Most people start noticing subtle improvements within the first week, more significant changes by week 3 or 4, and optimal results by week 6 to 8. Keep a simple journal if it helps. Note your energy levels, sleep quality, muscle soreness, and mood. Over time, you'll likely see patterns of improvement that will motivate you to stay consistent. Don't just accept exhaustion and weakness as your new normal. Don't resign yourself to poor quality of life. Your body has an amazing capacity to heal and restore itself when given the right nutrients at the right time. Those overnight hours while you sleep are when the magic happens, when your muscles repair, your energy stores refill, and your body resets for the next day. Make sure you're giving your body what it needs to make the most of that precious time. Start by having a conversation with your doctor. Get your levels checked. If you're deficient, develop a personalized supplementation plan that's safe and appropriate for your specific health situation and medications. Give it at least 4 to 6 weeks to see the full benefits. Pay attention to how you feel, how you sleep, and how your body responds. Keep your doctor informed of any changes, good or bad. And remember, you deserve to feel good. You deserve to have energy. You deserve to enjoy your retirement years, play with your grandchildren, pursue your hobbies, and live life fully. Don't let correctable nutritional deficiencies rob you of the vitality and quality of life that should be yours. Small changes can lead to profound improvements when you understand what your aging body truly needs. Thank you so much for watching today. If you found this information helpful, please give this video a thumbs up and share it with anyone you know who might benefit from this information. Leave your questions and experiences in the comments below, because I truly do read them all, and your feedback helps me create more content that addresses what matters most to you. Until next time, take care of yourself and remember, it's never too late to feel better. I'll see you in the next video.